So this is my ulna and radius bone. This is the ulna and this is the radius. So the green parts are the bone landmarks that I'll be talking about first. So the ulna is located on the medial side and it's longer than the radius. So on the proximal end is the olecranion, which helps the elbow, and that is up here. It moves distally and it increases in width. The coronoid process down here is an anterior projection. The olecranion receives the trochlear of the humerus, so that forms part of the elbow with the trochlear notch right here. The radial notch is a lateral surface of the trochlear notch, so it's just around here, and that articulates with the head of the radius right here. Then there is the tuberosity of the ulna, which is lower. This is distal to the coronoid process, and the coronoid process helps the brachialis muscle attach. At the distal end, there is the head of the ulna, and it articulates with the ulna notch to form, right here, to form the radial ulnar joint. The styloid process is on the posterior side, and this is a projection with a rounded head. So some of the muscles on the ulna I labeled in pink just to get the basis of where they lay. So at the proximal end is the brachioradialis, and that runs through there from the humerus. Around this area is the extensor carpi muscle, which helps extend. And there is the pronator teres around here, and the pronator quadratus around here, which is also onto the radius. So the radius, some of the bone landmarks are in green, and it is located on the lateral side. So at the proximal end, it has a disc-shaped head with a concave articulating surface. It articulates with the capitulum of the humerus and the radial notch over here of the ulna. So inferior to the neck, which is here, is the radial tuberosity, which is a bony projection. It's the point of attachment for the biceps brachii muscle. The shaft is down along here, and that moves distally, much like the ulna. In the distal region, we have on the lateral side, the projection is the styloid process, and the ulnar notch is on the other side, and that articulates with the head of the ulna, which is around here. On the anterior side of the radius, there is the flexor carpi muscle, which helps with flexion. And then on the posterior side is the supinator, which is around this area. So when I put the humerus and the ulna and radius together, they perform the extension, like so, and the flexion. So it just goes like this and like this. So this is the elbow joint. It would be covered in cartilage, however I couldn't obviously cover it just because it wouldn't hinge properly, which it is known as the hinge joint. convex surface that fits into a concave surface. It performs the flexion and extension. It's in the sagittal plane and the horizontal axis. So the trochlear of the humerus is gripped by the ulnar trochlear notch, which is like so. So a common sports injury is the tennis elbow, which is an inflammation of the lateral epicondyle. So over here. So you get this injury by overusing your arm and forearm that results in an elbow pain. So abrupt or subtle injury of the muscle and tendons on outside of the elbow. Some symptoms include pain, slowly increasing around the outside of the elbow. Pain is worse when you are shaking your hands, lifting, opening jars, and using tools, etc. It affects people usually around the ages 30 to 50, and about 50% of tennis players get it in their career. And that is how it got its name. So to diagnose it, they do blood tests and sometimes x-rays, not normally though. So to fix it, you can do physical therapy. There's forearm braces and tropical anti-inflammatory gels. And to help reduce the inflammation, you can rest, avoid activity in any parts of that area, and also apply ice.